If you're an older man and you masturbate, I need to ask you something. Have you ever truly wondered if it's healthy after the age of 50 or 60? Or perhaps you've worried in private, maybe even just a fleeting thought, that you might be causing some kind of invisible harm? If so, you are far from alone. This is a topic shrouded in confusion, clinging to outdated myths like stubborn shadows, and frankly, suffering from a distinct lack of clear, reliable information. This is one of the most common yet unspoken concerns for men in their mature years. And after looking at the available data, it's easy to see why there's so much uncertainty. Studies show that while a majority of men over 60 continue to practice self-pleasure, many are navigating this intimate part of their lives in the dark, unsure of the real effects on their hormones, their prostate, or even, and this is a big one, their performance with a partner. That's why today, we're diving deep. We're going to have an honest, science-based conversation. Forget the whispers and the guesswork. I'm going to walk you through 10 surprising benefits of masturbation in maturity. Some of these might genuinely shock you, but then, crucially, we'll confront 10 potential risks you absolutely need to be aware of to ensure your practice is a healthy one, adding years of vitality to your life. Let's unravel this, starting with the often overlooked good news. First, it's a cornerstone of maintaining penile health. Think of it like this. The act of achieving an erection is like a targeted workout, increasing vital blood flow into the spongy tissues of the penis, known as the corpora cavernosa. It's a form of physical therapy, if you will. This regular exercise helps maintain tissue elasticity, which, as you might suspect, is absolutely crucial for achieving and sustaining firm erections as you gracefully age. Second, and this is a point that often raises eyebrows, it powerfully promotes prostate health. This is a big one backed by serious science. Multiple large-scale studies, including a landmark one from Harvard University, have linked higher ejaculation frequency with a significantly lower risk of developing prostate cancer. The leading theory? Regular ejaculation acts like a cleansing mechanism, helping to flush out potentially harmful substances and secretions from the prostate ducts. Could this simple act be a key to long-term prostate well-being? Third, it actively strengthens the pelvic floor. Those rhythmic contractions you experience during orgasm, they're engaging key pelvic floor muscles, including the vital pubococcygeus muscle. A strong pelvic floor isn't just about better orgasms. It's vital for robust erectile function, enhanced ejaculatory control, and crucially, preventing that surprisingly common issue for aging men, urinary incontinence. Imagine having more control and confidence in this fundamental area of your health. Fourth, in our high-stress modern world, this benefit is truly incredible. It actively reduces the stress hormone cortisol. Research has consistently shown that orgasm leads to a significant and noticeable drop in cortisol levels. Lower cortisol isn't just about feeling calmer. It helps regulate blood pressure and reduce anxiety, making this a natural and readily available tool for both cardiovascular and mental well-being. Who knew pleasure could be so powerfully therapeutic? Fifth, it unleashes a cocktail of feel-good neurochemicals in your brain. Orgasm floods your system with dopamine, the very molecule of motivation and pleasure, and oxytocin, often lovingly called the bonding hormone. This natural mood booster provides a profound sense of well-being and emotional connection, which is truly invaluable for maintaining strong mental health and a positive outlook as you navigate later life. Sixth, it becomes an invaluable tool for the self-detection of physical issues. The regular practice of self-pleasure fosters an intimate familiarity with your own anatomy. This regular self-examination, which becomes a natural part of the process, is one of the most effective ways men discover early signs of conditions like testicular cancer, penile fibrosis, or other anomalies that might otherwise go unnoticed until they become more serious. Early detection can be life-saving. Seventh, it significantly improves sleep quality. Ever notice feeling deeply relaxed and sleepy after? Following orgasm, the release of hormones like oxytocin and prolactin, combined with that welcome reduction in cortisol, creates a powerful sedative effect. This helps your body relax deeply, making it easier to drift into a restorative deep sleep, something that often becomes more challenging as the years advance. Imagine consistently better nights of rest simply through this natural act. Eighth, beyond just the penis, it enhances overall pelvic blood circulation. Masturbation improves blood flow throughout the entire pelvic region. This has far-reaching benefits, supporting the health of your bladder, your prostate, and the surrounding musculature, actively preventing issues related to stagnation and poor circulation that can become more prevalent with age. Ninth, for men who might be experiencing changes in their sexual response, it can serve as a practical training method for ejaculatory control. For those who occasionally struggle with premature ejaculation, masturbation provides a safe and private space to explore and practice techniques like the stop-start method. This allows you to become more attuned to your body's signals and build greater control, skills that can then confidently translate to partnered sex, enhancing intimacy and satisfaction for both you and your partner. 10th, and perhaps most fundamentally, it actively keeps your sexual desire and those vital neural pathways firing. Remember, the brain is arguably the largest sex organ. By regularly engaging in sexual fantasy and physical stimulation, you are essentially keeping the neural circuits associated with desire and arousal active and healthy. This proactive approach helps maintain a healthy libido and sexual responsiveness, even if you don't currently have a regular partner, ensuring this important aspect of your well-being remains vibrant. But to paint a complete and honest picture, we absolutely cannot shy away from the potential downsides. A truly healthy practice is a conscious practice. So now, with that crucial understanding of the benefits firmly in place, let's navigate the 10 potential risks or negative effects that you need to be acutely aware of, because knowledge is power when it comes to your health. The first risk to consider is social isolation. This isn't about the act itself, but where it fits into your life. It becomes problematic when self-pleasure stops being a healthy part of your broader sexual expression and instead becomes a primary substitute for genuine human connection and intimacy. The key here is self-awareness. Honestly assess, is this practice complementing your life, or is it allowing you to withdraw from meaningful relationships? Second, there's the often overlooked risk of skin microlesions. This typically occurs when masturbation is performed too aggressively or without adequate lubrication. These tiny tears, while seemingly insignificant, can cause irritation, inflammation, and even, and this is important to note, create a potential gateway for infection. The fix here is simple but vital. Always prioritize gentleness and use a quality, water-based lubricant. Your body will thank you. Third, you might encounter desensitization. Think of it like this. If you consistently stimulate yourself in the exact same way, with the same pressure and rhythm, every single time, your brain can become conditioned to respond optimally only to that specific type of touch. This can unfortunately make it more difficult to achieve arousal or orgasm with a partner, where the sensations will naturally vary. The solution? Embrace variety. Experiment with different techniques, rhythms, and areas of focus. Keep things interesting for your body and your brain. Fourth, and this is a crucial point often missed, it can inadvertently mask the underlying causes of erectile dysfunction. If you find you can reliably achieve an erection during masturbation, but consistently struggle with a partner, it might be tempting to dismiss it. However, this pattern could be masking a more serious underlying health issue, such as heart disease, diabetes, or hormonal imbalances. Ignoring this signal could delay crucial diagnosis and treatment. If you notice this discrepancy, it is absolutely essential to consult with a doctor. Fifth, let's talk about nerve compression from poor posture. Many men, without realizing it, may habitually masturbate while sitting in a hard chair or hunched over. Over time, this can compress the pudendal nerve in the pelvis, potentially leading to uncomfortable genital numbness or even chronic pelvic pain. The ideal approach is to practice in a relaxed and comfortable position, perhaps lying down with proper support, allowing for healthy nerve function. Sixth, it can subtly morph into an unhealthy emotional escape mechanism. While the mood-boosting benefits are real, consistently using masturbation as your sole tool to cope with stress, boredom, or frustration can create a behavioral dependency. It's vital to cultivate a diverse toolkit for managing your emotions, including exercise, mindfulness practices, and connecting with others. Relying too heavily on one coping mechanism can limit your resilience and overall well-being. Seventh, the often lingering feeling of guilt and shame. Many men, particularly those from older generations, were raised with powerful cultural or religious taboos surrounding self-pleasure. If these ingrained feelings persist and cause you genuine distress or anxiety, it can be incredibly beneficial to consider speaking with a sex-positive therapist or counselor. Reframing this natural practice in a healthier and more accepting light can significantly improve your emotional well-being and self-perception. Eighth, while less frequent ejaculation can contribute to prostate issues, the opposite extreme, pelvic congestion, is also a possibility. Excessively frequent ejaculation, multiple times a day over a prolonged period, can sometimes lead to a feeling of heaviness or aching discomfort in the testicles and pelvic area. The key here, as with many things, is moderation. Pay close attention to your body's signals and allow for adequate recovery time. Ninth, a point to consider if you are actively trying to conceive with a partner, a potential impact on semen quality. While moderate masturbation doesn't harm your long-term fertility, ejaculating daily can temporarily reduce sperm concentration. For optimal sperm quality, studies generally suggest an abstinence period of 2 to 5 days before trying to conceive. This is a temporary consideration with a specific goal in mind. 10th, and finally, the risk of disconnection from reality, often linked to the consumption of pornography. If your masturbatory practices become heavily reliant on extreme or unrealistic pornography, it can unfortunately skew your expectations and potentially make it more challenging to connect with a real-life partner and experience mutual satisfaction. The key is to find a healthy balance, integrating any visual aids with your own imagination and memories of authentic, positive experiences. So, as you can clearly see, masturbation after 60 isn't simply a matter of good or bad. It is, in essence, a tool. And like any tool, how you choose to use it ultimately determines its effect on your overall health and well-being. The secret ingredient, the one thing that elevates this from a mindless habit to a healthy practice, is always consciousness. Practiced with awareness, a genuine respect for your body, and mindful moderation, it can be a powerful and truly marvelous ally for your ongoing health and vitality. I sincerely hope this in-depth conversation has been helpful and perhaps even a little eye-opening. I'm genuinely curious to know, what was the most surprising point for you today? Leave a comment below. Let's continue this important discussion together, openly and honestly. If you found value in this video, please give it a like and subscribe for more straightforward, well-researched advice on mature health. Don't forget to hit that notification bell so you won't miss our next conversation. Stay healthy, stay informed, and I'll see you in the next video.